Like I said, it reduces premiums. Here's some quick numbers. The Kaiser Family Foundation, which is completely nonpartisan, all they do is healthcare research. Everybody cites them, Republicans, Democrats, Greens, Blues, Reds, everything. They do an annual survey of health premiums, and this is the latest one. This came out in November. For HMO coverage on a family plan, it's $13,470. For PPO, it's $13,719. An HSA high deductible healthcare plan, $10,396. So you're talking about a $3,000 savings from an HMO or PPO, just if you switch to an HSA plan for your family. Same thing for single coverage. Almost $5,000 for both an HMO and a PPO, and it's under $4,000 for an HSA plan. When I had my HSA, it cost me $100 a month. On the individual market, you can find one for as little as $60 a month. And I encourage you to do that if you don't have health insurance to go find an HSA plan. Aetna recently reported that over a 6-year period, employers who switched to consumer-directed healthcare plans with an HSA saved $21 million per 10,000 employees. So big corporations are actually switching to health savings account plans. The one that we hear about a lot, and actually their CEO got a lot of flack for over the summer, is Whole Foods. Their CEO has an HSA plan. They contribute to it. They pay the premium and contribute to the HSA, so it's free money. He is literally paying his employees to have health insurance, and he can do that with an HSA because it's cheap for him. And these are the ideas that we're not hearing about in Obamacare or in the Congressional Democrat plan. We don't hear about these things. They ignore it. They ignore success, and they just think that, well, if we just expand Medicare to everybody, which is already in a fiscal train wreck, then everything is going to be just fine. But these are the ideas that we need to be telling people about. And if you don't already know about it, I encourage you to learn. There's a ton of information out there on all of this. Consumer-directed healthcare reduces the premium rate increases. This is something that's been big. We've heard about a lot of the individual healthcare plans in states like Virginia, Georgia, California in the past couple weeks going up 30, 40, 50%. If they were health savings accounts plans, they'd still go up, but at a lower rate. Basically, the Mercer Company, which is another independent analysis firm, found the annual rate increase for consumer-driven health plans was about half of that for PPO or HMO. WellPoint, which is a big insurer, and they're big in the individual market, and actually they're the culprits of those big rate increases. I don't want to give them a free pass here. They looked at the experience of 8,000 of its group accounts in 2008 and found that the PPO and HMO rates rose between 7 and 10%, while the previous year, while the rates for the consumer-driven plans actually dropped from 2007 to 2008. So they were able to find a way with a high deductible plan to actually decrease the rate. Federal employees, a lot of federal employees have health insurance or have HSA programs. So when President Obama or we'll say Senator Bennett or Senator Udall say, I want you to have the same healthcare plan as members of Congress, say great, because guess what? Most of y'all have HSA plans. And the annual rate is just 7% as opposed to the other ones, Blue Cross Blue Shield standard plan, which is the first plan I had when I was a federal employee, is up 13.4% for family and then 12.9% for single users. Consumer-driven healthcare is taking over the marketplace, and not taking over and then it's some sort of crazy revolution, but it is a revolution. 22% of the market is high deductible healthcare plans and consumer-driven healthcare plans. And this is numbers from the CDC and the National Health Information Service. I always forget what NHS stands for. It's funny, you live in a world of acronyms for so long, and as soon as you get out, you forget them all, working for the government. Almost 50% of persons with private plan obtained it by means other than through an employer were high deductible healthcare plans, which means they went and sought it out. There's a great website. There's a company based in California called ehealthinsurance.com. It's the Expedia.com of health insurance. You go in, you plug in your age, male or female, and it'll ask you some really basic questions, your zip code, and it'll basically shoot up a big screen that lists all these plans within a very reasonable price range, anywhere from $50 to $500 a month. This is all before underwriting, of course, so it is going to go up a little bit, but still, the information is there, and those more affordable plans do exist.
What is that website?
ehealthinsurance.com. A very good friend of mine, John Desser, is their VP. And he used to be a Capitol affiliate as well. When I say can we afford this, I'm talking about Obamacare. This is the main reason why we really need to be looking at solutions other than what has been put forward and that we're hearing about in the last year, over a year now. Medicare and Medicaid are really the reasons why healthcare is completely out of control, at least on the federal side, and why I find it appalling the federal government wants to even take more of the economy and put it under their purview, because they can't even run these two programs. Medicare and Medicaid alone account for 4% of GDP, and it will rise to 9% by 2035. Our federal government typically, not in the last year and a half, but typically operates at about 18 to 20% of GDP. So imagine that half of our federal budget is already going to be spent on two programs, and they want to add another entitlement to it? Just something to think about. Medicare's current unfunded liability, those are benefits that are owed but cannot be paid, stands at $37.8 trillion with a T, trillion dollars, or $333,000 per household. Who's got their checkbook? Medicare will be bankrupt by 2017, and actually that number is being accelerated because the current bill raised the Medicare trust fund in order to pay for it. Every time you hear about President Obama saying they're going to shore up the Medicare trust fund, he is full of it. They use the Medicare trust fund to pay for the new entitlement. So how are you saving money for Medicare? I don't understand. Medicaid costs $400 billion per year and is projected to cost $5 trillion over the next 10, and this is without any change to the current law. There are some states that are trying, one thing, the difference between these two things is Medicare is for old people and it's completely run by the federal government. Medicaid is for poor people and it is a joint state-federal partnership. Now there are some states that are doing some great things to try and save Medicaid. Indiana has an HSA law, Florida has an HSA law, South Carolina has an HSA law, Georgia just passed one. There's a lot of states trying to find high-deductible healthcare plans, inject them in the Medicaid program, give people money to go buy the plans that they need instead of the state government trying to administer it and lose millions and millions of dollars every year trying to run this program, which they clearly can't do either. The Congressional Budget Office, that's what CBO stands for, I'm sure you've heard a lot about that agency lately, estimates that the individual and corporate income tax rates would have to rise by 90% to finance projected increases in spending, that's just on Medicare and Medicaid, by 2050, and that's without any new type of public option plan or new healthcare plan that President Obama is going to send to us, or may hopefully not send to us. Insurance companies, I was talking about the rate increases. This is something to keep in mind. I know we want to beat up on insurance companies. I beat up on them all the time, but they're not necessarily the problem. They might be part of it, but not the problem. And here are just some 3 quick stats as to why. In November, ABC News corrected the Democrats' claim that insurance company profits are responsible for increasing healthcare costs. ABC News said the company's profits still represent a minuscule percentage of the $2.5 trillion Americans spend every year on healthcare. Insurance company profits in the large picture have very little to do with overall rising healthcare costs, and that's from a Brookings Institute expert. Brookings is a pretty center, almost center-left kind of think tank in DC. They're definitely not the Heartland Institute, they're not Independence Institute, they're not Cato and Heritage, which are the libertarian and free market guys. So that speaks pretty big. The new government plans proposed by Democrats is supposed to control costs by reducing the profits of insurance companies. We're about to basically put a subsidy on everybody making below $100,000 a year, and all that money gets to go to, who can guess? Insurance companies, because to pay for the plans. But Fortune magazine found that the top 14 insurers earned a combined $8.61 billion in 2008, which is a lot of money. But consider that Medicare lost an estimated $60 billion in fraud in last year alone. Fraud, waste, and abuse. So what program really needs to be fixed before we start tackling healthcare?